Welcome, my Phoenix family, to One-Footed Phoenix. Today we're going to talk about CRPS. November is CRPS Awareness Month. CRPS stands for Complex Regional Pain Syndrome. CRPS is so complex that doctors often misunderstand it. It's a nervous system disorder. CRPS is regional because it's often in a limb, such as an arm or a leg, though it can spread to the entire body. The pain from CRPS is so severe that it's even rated above childbirth on the McGill pain scale. But this pain never goes away, unlike kidney stones in childbirth. Let's talk about how CRPS starts. CRPS can be brought on by a crush injury to a nerve from an accident such as a car crash. It can also start because of a surgery or many surgeries. Sometimes it even starts spontaneously. So what are the symptoms that CRPS patients experience, and what does it feel like? It feels like having your affected limb on fire constantly with no end in sight. CRPS is like having your affected limb in a bucket of ice water and never being able to take it out. The affected limb goes purple and gets very swollen. The skin often looks marbled or mottled. Anything touching the affected limb hurts. Even just sheets or socks or a light tap feels like someone is sawing into the limb or poking 1,000 needles into it. Many people who have CRPS also struggle with mental health that is unseen, such as depression and anxiety. Please note that there is no known cure for CRPS, but let's talk about hope and possible treatments for CRPS. Most doctors start treating CRPS with nerve blocks above the affected limb. However, these nerve blocks can also cause it to spread. Nerve blocks in the spine are meant to target the nervous system that is on the fritz with CRPS, but they never worked for me, and the sedation would make me very sick. Ketamine is given through an IV or through shots. It helped me for quite a while, but then I built up a resistance to it, and ketamine just stopped working for me. Some common medications that are taken orally for nerve pain include gabapentin, Lyrica, and low-dose naltrexone or LDN. Low-dose naltrexone is a medication that made my mental health go nuts. Other prescriptions for CRPS may include opioids, medical cannabis, and lidocaine products. Speaking of medical cannabis, if you would like to hear more about why it didn't work for me, please like this video, share it, and subscribe, as well as let me know down in the comments down below. Bisphosphonate infusions are typically given in Italy for CRPS, and they are given experimentally by my doctor here in the US. These treatments have helped me walk and use my prosthetic leg again. However, my doctor only runs these as experimental, and he only really does them for local patients. Amputation in some cases of severe CRPS can be helpful to patients who want to walk again and have CRPS in just a limb. However, some patients have CRPS and live with it in their full body. However, I need to give you a word of caution that amputation is not a cure. Amputation should be considered carefully with many doctors before making the decision to go ahead with it. Do your own thorough research as well. Some common side effects that you may experience from a CRPS amputation can be that you may have phantom limb pain in varying severity. You may not get off pain medications. It's possible that you won't be able to wear a prosthetic limb due to issues with compression. It's also very likely that you will need professional mental health help as you go through processing everything and going through grief. Some common benefits to having a CRPS amputation may be that you may have less pain with amputation than you do with CRPS. You may experience a better quality of life and greater mobility. If you enjoyed this style of video, be sure to let me know in the comments down below. This video took a long time to make. If you would like to see another One-Footed Phoenix video, click on the next video. Thanks for watching! Bye!